Hello everyone, my name is Somaili Vela, and today we will be learning about appendicitis in the pediatric population. So as you can see from this picture, this little girl has appendicitis. She looks very uncomfortable, and this is often how children may appear on admission to a clinic or a hospital setting. So my goals for this lesson is that you will learn about the pathophysiology of appendicitis, its diagnostic evaluation, its therapeutic management, and the required nursing management of the pediatric patient with acute appendicitis and postoperative care. So by the end of today's lesson, students should be able to recognize at least 5 common symptoms seen with appendicitis. Students should also know what the 3 nursing interventions that should be prioritized in managing a pediatric patient with appendicitis are. And students will also be able to list at least 4 expected nursing care implementations with a postoperative perforated appendix. So as you all know, I gave you a short quiz as a pre-assessment of the lesson material. I also provided a rubric regarding the initial and secondary assessment of children with appendicitis. And at the end of this lesson, I will be providing you the same short quiz as a post-assessment of the materials learned. So as a review, here is the location of the appendix, which is attached to the cecum, which is where the large intestine begins as the ascending colon. So what are some causes of appendicitis? So an obstruction of the lumen of the appendix, usually by a hardened fecal matter, is one of the most common reasons. Lymphoid tissue can also become swollen after a viral infection, which can obstruct the appendix. And more uncommonly, a parasitic infection or pinworms can obstruct the lumen of the appendix as well. So as you can see in this image, there's a fecalith, which is that hardened fecal matter that obstructs the lumen of the appendix, causing inflammation, which will eventually develop into an infection. So let's go over the pathophysiology of acute appendicitis. So with an obstruction of the lumen of the appendix, mucus secretion is blocked and pressure starts to build, resulting in compression of the blood vessels. So this lack of blood flow then causes an ulceration of the epithelial lining of the appendix, resulting in bacterial invasion, which will develop into an infection. As for a perforated appendix, necrosis of the tissue will start to develop, causing a rupture of the appendix with fecal matter and bacterial contamination of the peritoneal cavity. So this resulting infection then will spread throughout the abdomen, causing peritonitis. And this peritonitis inflammation will cause intestinal obstruction of the small bowel, often resulting in an ileus. So in this picture, I've provided the most common symptoms of appendicitis, which include a sudden onset of abdominal pain, often radiating to the right lower quadrant. Nausea and vomiting might be present, loss of appetite, fever, constipation or diarrhea, and there may be abdominal bloating as well. Some other symptoms that may be seen is tachycardia, rapid shallow breathing due to the infection and abdominal discomfort, pallor, lethargy, irritability, and a stooped posture. Okay, so let's go over the diagnostic evaluation. So a thorough medical history of illness is very important, as well as a physical exam. And usually the most intense pain is to the right lower quadrant at the McBurney point. So when lab analysis are performed, you will see elevated white blood cells. A urinalysis is also done to rule out urinary tract infection. And an HCG will be done on adolescent females. This stands for human chorionic gonadotropin. This is important because this will help rule out ectopic pregnancy. Because if a young lady is pregnant, the HCG will be positive. And the gold standard for diagnosis of appendicitis is a CT scan, but sometimes an ultrasound of the abdomen will be done instead. I've also included a vital signs chart of the normal vital signs of a pediatric patient for respiratory rate, heart rate, and a systolic blood pressure based on the age and weight of the patient. So let's take a look at therapeutic management. Surgical removal of the appendix performed prior to a perforation is ideal. This is known as an appendectomy, which can be done laparoscopically or as an open appendectomy. And as we discussed earlier in the lesson, one of the things nurses need to prioritize is IV antibiotic therapy prior to surgery and postoperatively if the patient is ruptured. Just as important is IV fluids for electrolyte replacement prior to surgery and afterwards as well for appropriate hydration. In addition, if the appendix is ruptured, antibiotic therapy will need to be continued. Often, if the patient arrives ruptured, which doctors can often tell symptomatically, antibiotic therapy will be given for at least 5 days prior to surgery to just control the infection. The patient will be discharged and will return for an interval appendectomy, which may be performed 2 to 3 months later. However, if an intra-abdominal abscess is present, a CT-guided insertion of a tube for drainage of pus and fluid will be inserted into the abscess if this is required. So nursing care of a pediatric patient with a ruptured appendix and peritonitis will include continued antibiotic therapy, pain management, IV fluid therapy. Patients are normally kept NPO as well to rest the bowels, and a possible NG tube placement may be necessary if the patient develops an ileus. Listening for bowel sounds is also very important. That needs to be done on a regular basis to assess for improvement of bowel motility. And if a dressing is present, wound care management may also be applicable. 3 differential diagnoses I chose for appendicitis are gastroenteritis, a urinary tract infection, and Meckel's diverticulum. As you can see, there are several symptoms that these 3 diagnoses share with appendicitis. And as you can also see, especially with the urinary tract infection, there are more pertinent negatives than as with the other 2. So there are several nursing care plans that can apply to appendicitis. I've only included 2 here, which are acute pain related to inflammation of the appendix as evidenced by sudden abdominal pain that starts around the navel and radiates to the right lower quadrant, and also risk for infection, which is evidenced by abnormal vital signs and gastrointestinal problems such as diarrhea, nausea, and vomiting. But there are many others that you can use as well. So finally, for additional resources, I've chosen a couple of sites in YouTube for additional information on appendicitis in children. I hope you get an opportunity to check these out. And these are the references that I used for this presentation, as you can see. And of course, as I mentioned earlier in the lesson, it's quiz time again.